is a given. But the majority of our referrals are general protective services. And you all have heard about the numbers, and they have grown every year since Sandusky. And so when I started, Lamont and he brought this idea to me. I had recently read about it as well and was really excited about it. So when we get a phone call now, I'm going to try not to jump around too much, so let me go back to the screening process. When we get a call, if it's a general protective services call, we have to, our call screeners work with the supervisors. They get all the information from the caller, most often schools, doctors, they get the information from, and they make a decision as to whether or not this particular case has to be investigated. And there are one or two specific risk tools, paper assessment tools, that folks use to help aid their decision making. But it's not enough. And when I learned about this model, it felt like we were sending our caseworkers into the field or answering phones, and they didn't have their hammer in their toolbox. So yeah, they could get the job done, but not as easily as if they had this other tool. So currently our we have 2 call screeners for children and youth. So they take all the phone calls, and then they work with the supervisors to determine if somebody needs to investigate that family. So they're either screened in or they're screened out. So a screened out family would be a family that we think, based on all of the information collected on the phone call, that they don't really need to be investigated. Sometimes there's custody disputes. When the schools first had to make the phone calls, we got calls for literally every scratch. And we would still rather have more calls than not, so we can make sure we're helping the right people. But that's part of the problem, is making sure we're helping the right people. So there's a whole lot that goes into that decision making, and it's as objective as possible, but at the end of the day, we're humans, and so there's the human side of it as well. The predictive risk model is meant to be an additional tool that our human caseworkers use to make their decisions. It is not meant to replace the human decision making. So I really can't stress that enough. This is not a replacement. It's an additional tool for people to use. So some of the things that I have done then since starting here, I have inches and inches of paperwork on Allegheny County's model, which I'll give you a brief overview of, and spent a lot of time trying to understand the technical aspects of it, as well as the ethical considerations, which I'll touch upon briefly. And one of the things we did early on was I worked with Bob Mace and Chris Faria in IT to determine what our IT capabilities were, and we talked about what additional infrastructure we would need to develop this kind of tool. And in September of 2018, so almost 2 years ago, I had the opportunity to go out to a conference in Penn State. I think the title was Data Analytics and Child Welfare. And I happened upon it by fate, luck, whatever you may call it. And the woman who helped develop this model for Allegheny County, her first name is Rima, and her last name is really long. It starts with a V, so I just call her Rima. But it's in the paperwork that you all have. So about 2 weeks before this conference, I saw that she was going to be there, and I talked to Lamont, and he said, "You have to go." I said, "Yes, I do." And so I went, and it was phenomenal. And I came back having all sorts of ideas on how to use data analytics, and was told one project at a time. So that's what we've been working on ever since. But I had the chance to meet Rima and speak to her, and she actually told me that she had already been in conversations with Pennsylvania at the state level to develop a statewide system. And ultimately, that's the long-term goal. But the state being the state, they don't quite have the nimbleness that we have, and they take a tad longer. So then part of the discussion became, okay, we're still going to focus on the statewide model. And the state of Pennsylvania has a contract with Rhema that's going through their procurement process. It just takes a lot longer than ours does. And so we talked about Northampton County, and Bucks County actually being the pilot counties for this sort of statewide model. Now, ultimately, my counterpart in Bucks County took over as the deputy or the secretary for OCYF, the Office of Children, Youth, and Families at the state, which has been really good for us. We have a strong ally there, but they're sort of in flux now in Bucks County. So now Northampton County has a chance to be really on the cutting edge of piloting this model. So one of the things that we had done along the way was meet with a group of folks from Bucks County and Dauphin County. And Dauphin County had worked with Deloitte to build an integrated data system for them and run dashboard reports to the tune of $1 million a year. And I said, I don't have that kind of money in Northampton County just to integrate our data and run reports. And so that was not an option. Because truly the easiest way is to just sort of outsource it to a company and have them do it and you're done. But that's just not even worth the cost. So back in the fall of 2019, when Kevin Dolan was still here, he and Julie Bader and I and Chris Faria went out to Bucks County, and Rima flew in. Rima's from New Zealand, her and her team. And she has a lot of business in PA and Washington, D.C., actually. So she had flown in for some other things. So she met with us and went through a potential kind of concept of how we could roll this out and be a pilot county. So we have had multiple Zoom conversations with her since then. She and one or two of her folks were supposed to come to our offices at the end of April to just kind of work through some of this and see if we could really make it happen. And then, of course, the pandemic hit, so that did not happen. But we continued via telephone, and we formed a group of folks within DHS, CYF folks, some of our data folks, Gary Rushman and Iris, to kind of talk through this model to make sure it was really something that would be compatible with us and ultimately be useful and beneficial. And as such, we have continued to proceed. So the interesting thing is, right now there's different counties who are using this. Allegheny is the only other county in Pennsylvania using this risk model. Douglas County in Colorado is, with Rima and her team, built this model. And California, I believe their system, if I'm not mistaken, is statewide. And Emily Putnam Hornstein is one of the other people that was part of that development in Allegheny County, and she and her folks did it for themselves in California as a statewide system. So from what I am hearing at the conferences that I attend, and especially the ones at Penn State, we have all of this data. We don't use the data. It's never, I think that somebody said it's not an issue of having enough data, it's having people to do something with the data. So essentially, we've just gone back and forth with Rima about what this would really look like for Northampton County, what a contract would look like if approved. We've worked with our CAPS vendor. So CAPS is our state system for children and youth. That's where we enter all of our data and pull all of our data from. So that's sort of what we've done. Let me give you a little bit of a overview of what the predictive risk model is and what it would do for us. So in Allegheny County, they already had an integrated data system, and actually they had an enormous amount of data sources. They have data sharing agreements with their school districts and all kinds of places. We don't have that, and it turns out we don't need that. So that's the good news. But they put together this predictive risk model, which this is the technical part that I can't totally wrap my head around, but they develop based on all of the data. So it's all based on historical data that we have in our system. They develop an algorithm to make predictions. So there's a couple different ways that they have done this. The one that we are looking at in particular is when we get a phone call, so our call screeners for CYF get a phone call, what is the likelihood that that child will end up being placed within the foster care system or some other sort of out-of-home placement within the next 2 years? And The other thing that we can look at is if we screen a family out, what's the likelihood, based on this model, that the same family will get screened in at some point within the next 2 years. So the ultimate goal is to make sure that we are serving the right families and that we are not intruding on the lives of families who don't really need our services and assistance. So when they developed this model, they basically took all of their historical data, a few years worth, and developed the model, tested the model, was accurate enough to use. So what happens is we get a phone call, we put the information in, and it generates a risk score. So in Allegheny County, they call it the Allegheny Family Screening Tool. So that generates a score 0 to 20, 20 being, a red alarm, run now, 0 being there's, little to no risk. So the only people who see that score are the call screener and the supervisor, so that they can work together to use this tool to aid in their decision making. Again, it's not to replace the decision making. It's not, I got a 10, I have to go. It's we're going to talk about this and we're going to see if that's what really makes sense. And the caseworker assigned to investigate it does not get this risk score, because one of the things they talk about is confirmation bias. So if I'm investigating and somebody hands me a risk score of 20, I might go out to that home and see things that maybe really aren't that big of a deal, but because I already have that bias in my head, that's what I see now. So that score is not shared. So I could go on for hours about that, but I will not. I promise I will not do that. But I can answer questions. But there was a couple of interesting things that I thought would be worth noting for the purpose of this initial conversation. One of the things that they found in California, for example, was more white children were screened in than black children, and more minority children who were at low risk were screened in than low-risk white children. And in one of Rima's conversations, she was talking about, we were talking about racial bias, and she said it certainly, it appears, and I don't think there's quite enough data to totally verify it yet, but it appears that folks are screening in more minority families, more black and brown families, who truly are at low risk, while screening out more Caucasian, high-risk families. So we're all humans. We all have different kinds of biases, and hence the reason for one more tool. So some people, the big concern when they did this in Allegheny County, they did all sorts of public meetings and hearings about it. The model went through an separate ethical review. There's paper published on that. Because one of the big concerns was, is there a racial bias within the model, right? Because they used criminal justice data as part of their model. We know that there's already bias within that data. We don't need that data to do the model here, but ultimately what they found was that the model did not have racial bias. If anything, it tended to eliminate the human bias. But it wasn't just racial bias. It was also, I think I already said Lamont and I were talking about it, decision fatigue. So when we get a family who we have gotten 2-3 calls about, we've investigated them, they don't need referral or they don't need our services, we screen them out, and we get the 4th call and the 5th call and the 6th call, people, they get tired of dealing with the same families, or it's well-intended, or they think we've already been there, done that, there was nothing there the first time. Well, it turns out the more referrals you have on a family, the higher risk that family really is of needing services. So it eliminated that bias as well. One of the most important things for me in this is this tool will help our caseworkers better determine the families that need our services the most. So we're better utilizing our resources. We're getting the services to the families most in need, so that the idea being that we can avoid more placements. And sometimes, almost more importantly to me, we're not knocking on the doors of families who don't need to be investigated and don't need our services. There is significant trauma that comes along with having your door knocked on. If somebody came and knocked on my door, that would be horrendously traumatizing. And if I don't need to have my door knocked on, I would prefer it not. So that was one of the things that really intrigued me about the model. So that is, I mean, that's like, 2 years worth of reading and learning and absorbing in a very short but probably still too long nutshell. So where we're at now is we're working with Rima. She did initial, this is an important piece, she did an initial test run with the data that we have in CAPS, but it was not our data. She used Allegheny, not Allegheny. There's a county that they have data from that utilizes CAPS data. So they pulled the information from that to see if the model would be reliable. Because if they develop a model for us and it's 35% reliability, there's no purpose in that, and it's a giant waste of time, money, resources, everything. So their initial investigation indicates that this model would be reliable enough that it would be a valuable tool to have for the county. So we've done that initial legwork, and we're hoping to get ready to start moving forward in the near future. But that's where we are at now. That was a lot. Questions?
I just have one. So I'm assuming it's not going to hurt any of our grant capabilities, right? Because it's not really, it's been approved. They're getting their grant money in Allegheny County.
Right. So it's I've been scrolling away.
The biggest thing, right?
Sure.
Yeah.
So I've been scrolling away some extra dollars here and there to be able to anticipate funding the project. Ultimately, we've talked about doing a 3-year, I'm going to do 1-year contracts here, but a 3-year contract, so to speak, in terms of the first year, if we proceed, will be the development and deployment of the model. And so in time frame, that's how long Rima's confident now they've done this work enough that I think in Allegheny County it took 2 to 3 years before they could deploy it. Here she thinks that under 12 months they would be able to deploy it. And then the second year would be, testing it, modifying it, making tweaks and changes, and the third year maintenance and stuff.
It's not the state though.
Right.
It's not going to hurt us on any
No.
funding for any
No.
services or something.
Nope, not at all.
Okay, great.
Not at all. And when I'm not gonna say if, when the state finally gets to their own statewide model, it also, because the other part was, why would Northampton County pay money to do this now if the state's gonna do it in 3 or 5 years and then you have to pay again? But the concept is that it will be something, whatever Rima ends up building for us is enabled to be a statewide model that then we just already have and have piloted to better roll it out for the other counties, if that makes sense.
Are there any grants available to pilot this program, since it's already in use in Allegheny County, which is a much larger area?
Sure.
So would we be able to get a grant that might be able to fund this kind of program? Because I'm thinking that you're going to implement this with the hope that it offsets the cost of the $21,000 a day.
Sure. So the answer to that is there could be grants, and we've been keeping our eye out. And frankly, Rima and her team are willing to help explore that. They've used foundations. They've gotten funding from foundations to have partial funding. So yes, the answer is that exists, and we're always on lookout for any grants, but specific to this project as well. And our hope is, especially now that I have a friend, so to speak, at the state in OCYF, that part of our needs-based budget request, we are going to find a way to request some of this. Now, whether it's granted or not, I obviously can't control, but that's the thought process as well.
Right. So the implementation of this program, again, offsets the cost of that $21,000 a day. How soon can we see the return on that? Like how much will it aid? I mean, it's not just
Sure.
a cost thing, obviously.
Correct.
It's the quality of the programming as
Right.
well, but you have to weigh all of that.
And I don't know, I don't have an answer for you today
Okay.
for that question, because Allegheny County's been using theirs now for a few years, and I think I asked Rima a question very similar to that, and she was going to speak to them to try to get some of that data and get back to me. So when I have it, I'll gladly share it with you. I also had talked to Rima about being present via Skype to you all at some point to discuss this as well, and she's more than willing. But so I don't know the answer. The hope is that obviously over time that we see those savings, right? So instead of locking the old barn door after, we're closing the doors at the beginning and we're going to spend the money on prevention and the services up front. The nice thing about the timing of all of this is that with Family First coming, although it was delayed for a year because of COVID, but it will be coming, those federal dollars will be able to be used towards prevention efforts. And so the alignment and the timing of it all stars seem to be aligning, I guess, is what I'm trying to say.
So is there any liability in screening an individual or a family out and then later having something happen?
Sure. So, that's the impossible scenario that our folks deal with every day. And when I had told a screening supervisor about this a year and a half ago, she said, I would love to have a tool to help me with this. She said, I sometimes lie awake at night. These are life and death decisions we're doing every day, and they're doing the best job they possibly can. But we're not providing them all of the tools that they could possibly have to do it. So we face that kind of question every single day. And I will tell you that the result is we err on the side of screening more families in, because it's a lot easier to tell the state why you went to see somebody than why you chose not to go see somebody. But that's not okay either, because some of those families don't need us to be knocking.
Yeah.
And we're traumatizing them. And so those are the families, you have your very clear cut, right? Like, you have to go, or you don't have to go. It's the gray, right? And so that's specifically part of what this model will help us with. But that's a question we deal with. We grapple with that every day.
But is there any liability for using this system if something would happen? Do you know what I mean?
I do. I guess I'd have to leave that question to the lawyers. He said the same as we would have today.
Okay.
We have paper and pencil tools. The thing about the predictive risk model is, it's an algorithm, so it aggregates all this data immediately, at the push of a button. I've talked about how Iris pulls up the screen for this service and this service and this service. This just does it all at one time.
I think Mr. Heckman would know the answer to this better than even I do. But I think there's very little in terms of, you're using the word liability. I'm thinking you mean civil liability.
Yeah.
There's very little civil liability because of governmental immunity and statutes that protect, because they're making judgment calls based on their knowledge, training, and experience, and sometimes you're going to get those wrong, unfortunately.
But if you're using a predictive reliability tool, then
Correct.
you're doing something, so it's not like you did nothing. So
Correct.
you're saying based on this evidence.
Yeah,
I get.
It's just another tool to aid us, but the data doesn't lie. And when
Right.
you take, for example, when you take race out of the model, they had done, I don't know if it's in or out at Allegheny County right now, but they tested it both ways. The results were about the same, but they found it reduced racial bias in some other areas. So I totally lost my train of thought. I apologize.
It's Sandusky compliant. Basically, you're doing everything you need to do within the guidelines of Sandusky while using this tool to rule in or rule out the necessity of a call.
And my hope is that we take the staff that we have. You ask all the time, do you have less paperwork yet? No. And I don't see them changing that anytime soon. So the hope is not we won't need as many staff. The hope is that we have this many staff, but now they can focus on the right families. Their caseloads will hopefully be a bit smaller. so the right families can have more intensive services, be done sooner, not need to come back. The other piece is when we stop invading our Black and brown families as much unnecessarily, that hopefully we can start to rebuild some of our trust with them. I mean, obviously, children and youth now, I don't think, you all have a different perspective because you're here, but we don't have a positive reputation, generally speaking, in the community. And we would like to get to the place where we redevelop some of that trust and folks are either accepting of our prevention services or seek our prevention services, because we don't want to place children, ever. But we have to sometimes.
A call and a rule out doesn't mean there won't be a referral. It just won't be necessarily a referral to placement and
Correct.
visitation.
Correct.
But they could be referred to other preventive services.
Absolutely, absolutely.
So they're not lost in the. Sorry, Kevin.
It's all right.
Go ahead, Carrie.
I'm using my fancy. My question to this is, you said that you eliminated a race fund to begin with, or they tried to? Did they try to eliminate race and just take family? Did that figure any differently?
Could you maybe?
As far as
give-
intaking when you're doing this? Because
Oh,
you say
do
you're
you
breaking it
mean-
down by black and browns and whites. Why do we need that anyway?
Well, you mean in terms of our current processes now or the predictive risk model?
Either way.
Well,
Why?
that's a good question about why we have it now. I mean, that's, the forms that we have are state forms. So I have to get back to you on that question, Mr. Mars. I really don't necessarily know the answer. But it's a really valid question, and honestly, not one that I don't think I had considered outside of, with the risk model, yes, but not in terms of our current paperwork.
I think what he's asking is, how do you know it's a problem?
How do I know it's a problem?
Yeah, what I'm basically boiling down to is we're putting it in a category, we have less risk black, more risk black, less. Why don't we just have risk, period?
Well, so we,
Eliminate color.
right,
That's the problem we're having nationwide.
yes. And I don't have the answer for you today, but I will tell you, the forms that we have are state provided, they're state mandated, right? So we have to use those, and on that is race. I don't necessarily know, race is on almost every demographic form we fill out, but
It's on any form we have, which
to
is.
your point, it would be an interesting experiment to see what happens if we take that off the paper and give an intake worker and a supervisor the same family, and one's black, one's white, or take it off altogether and see what decision they make.
Yeah, I'm really curious to see, because there is bias in all of us,
Yes, I
no
agree.
matter what color we are.
Yep.
Or what a demographic we come from. And I would just like to just eliminate that if possible. Now, I know I walked in late on this. Who's handling this? Your supervisors?
Hailing it.
Who's going to be handling this tool? Your supervisors?
So the tool, once developed and implemented, that we have 2 call screeners in children and youth who get all the phone calls with referrals.
Right.
And then they speak to the supervisor to make a determination if a family has to be screened in for further investigation, or if there aren't any child welfare concerns and they can screen it out. Those are the basically 3 or 4 people who would have this information. The caseworker doing the actual investigation, I talked about, they don't get the score because we don't want to,
Prejudge.
yes, the confirmation bias, right? It's a 20, I go out, I see things I wouldn't have otherwise seen, or vice versa. It's a 2, and I don't see anything, but I miss the obvious because I'm already biased against that. So the person investigating, they don't have that score.
And before you even looked at this program, I have to ask the question, are the people that we have in charge of our caseworkers, our supervisors, are we constantly being trained and updated, and they're going through various classes to make sure we're on top of their game? Because they're making placements, am I correct with that? The supervisors are making some judgment as to place somebody that needs to?
Oh, absolutely, absolutely. They have, first of all, I give them a ton of kudos because they do a pretty darn good job with what they have, right? And, but there's all sorts of systems. Robin could even, I will put you to sleep, but having been in children and youth, she could probably even lay out the placement reviews and the conversations that happen between caseworkers and supervisors, and then the legal team and the attorneys to determine if a child really has to come into care. There's a whole lot of vetting and investigation, and caseworkers eventually get good enough that when they come to those staffing meetings, they know the questions that are going to be asked and they have the answers. So when you're newer, you go in and they say, well, did you ask this? Did you find out that? No, okay. So, you know, that's how they learn. But, so yes, they're constantly being trained. A lot of it on the job. The caseworkers they have over 100, I think it's 160, but it's over 100 hours of training before they can even carry a caseload in children and youth. And one of the things we did, and Robin did this for me, I asked her to find a provider to get us trauma training for all human DHS staff. And I get everybody trained once, and then everybody retrained, you know, an annual kind of refresher. And so COVID threw a wrench into that for a while, but we had our first one today, and all the DHS staff who already haven't had it, will be trained by the end of the month. So we're always looking for innovative, trauma's not innovative, but it's to trying to stay current with what's going on.
We got their hands full. I was just curious. Are we constantly trying to give them as many tools? Like, this is a nice tool from what I read at it, but I just want to make sure if there's anything else out there we can get to them, give it to them. We got to make it as easy as, I don't want to make it easy. We have to put the human element into it.
Yes. This, before you walked in, Mr. Myers, I said, this is not meant to replace the human decision-making. This is meant to be a tool to aid the decision-making. It will, if it ever replaces the human decision-making, we're doing something wrong. And we have to go back to the drawing board, because that's not the idea.
Mr. Lawton, I'm sorry, are you finished?
Oh, yes, ma'am.
There's several other questions that you want to get to.
Yep.
Is that about something?
I love new tools. Tools are great things. If they can make your job easier, all for it. So, but I really don't want to talk about the tools. I want to talk about what the county executive talking about the money end of it.
Mm-hmm.
And I may have missed this, but, you know, we're looking at a state that's going to flatten our budget or reduce it.
Yep.
Our return on this investment, we don't know.
Correct.
And for all intents and purposes, it's going to be a great return. You know, you're not going to be able to stop, but the value of a tool,
Sure.
some return makes sense.
Sure.
Did I miss what the cost of setting a program
No,
up like this?
we didn't talk about that. I'm gonna say give or take 10,000, because I don't have the final number in front of me. It is
Approximately
either
10.
$220,000 or $230,000 in total. That is for a 3-year contract. So for 3 years. So keep in mind that Dauphin County pays $1 million every year to Deloitte, just to manage their integrated data system and run dashboard reports, which are beautiful, by the way.
So that's the cost of the data system that you're going to use?
That's the cost of the development of the data system, the implementation of the data system, the rollout, the follow-up, the tweaking, the modifying over the next 3 years.
So after 3 years, what's the cost of running the project?
There is no, it's not that there is no cost, there is minimal cost, and if we wanted to then say in 5 years, if they wanted an update, then maybe that's something that you go back and it's a much smaller fee to have some modifications made. The bulk of the money is for the development of it. When I talked to Rima about this almost 2 years ago now, she said, she's a professor at a university in New Zealand, economics, I think, and but is very immersed in child welfare. And we talked about there being a cost to counties and states to do this, to have skin in the game, because this is it's a big project, it's a innovative project, right? But it's not, she has always said it's not for her and her team to make money. I know from what I've read about private companies who do this, you just can't even, I mean, 230,000 is, it's a lot of money, I don't mean that, compared to what a private company would charge is just not even comparable. So that's the cost. So that's why I've been squirreling away some funding. And so even despite the flat budgets, we've been saving and scrimping, and we have the funds
I just
available.
want to say that's a much better answer than that $1 billion you started with earlier. That scared, I knew it wasn't going to be that number, but I think
No,
where
oh,
it's
no.
just coming in at.
No, no,
so-
no. Yeah, no. You know what? When I heard that about Dauphin County, I almost fell off my chair. I just can't imagine coming to you all asking to spend that kind of money.
Much better number.
A much better number. Did you have another question, Mr. Lott?
No, that's it.
Okay.
Thank you.
You're welcome.
What's your, go ahead.
How many counties doing this? How many counties doing this?
Allegheny is the only other county in PA. Douglas County, Colorado is doing it with the same group of folks. And the state of California has a statewide model. There are a lot of other places that do this. A lot might be, I use that word loosely, so that's not fair. I don't know the number. There are other counties throughout the United States that do this, but they have contracted with private companies. And all of the stories that I have read about that have not been smooth sailing. One, for example, in Florida, the company who built it wouldn't give the Children and Youth Agency the data or the how and the why. I mean, it was crazy. So those are the three that Rima and her team have specifically worked with.
You done? Go ahead.
Yeah, thank you. I was just at the doctor today. I have nothing, I'm gonna cough, but it's not contagious. I don't have COVID. What I have can't be transmitted. I have a patent on it. But anyway,
It's the Ron. dude.
yeah, it's, no, but I can't
that to Linda
talk with this
earlier.
on.
That's
I'll
okay.
promise I'll put this on during the meeting. Everybody's bad. I wish I could do that when I go to Wawa. People would stay away from me. But the thing is, yeah, I mean, I understand data drive, there's always PhDs out there, as you well know, who come up with models. They've been doing it since the dawn of
Sure.
welfare services. They're always selling stuff. And some of them are great and some of them not so great. But I remember when we first started in child abuse, one of the first years in the state, our tracking was we put a map of Northampton County, one of those neat maps, and we put a yellow pin in if it was indicated and a
Yeah.
red pin if it was founded abuse.
Yep.
And so you could say, oh, wow, I didn't realize so many were in this area or
Yeah,
that area.
pockets, yeah.
But, and we didn't have PhDs, but, they didn't pay us for it either, other than their salaries.
You found your own data.
Yeah, that's leads me to my first question.
Sure.
Because I know you're gonna get a lot of questions on money and that. My question is, especially now, more so than back in the Stone Age when I was involved in doing it on the street. I mean, it was somebody said they knew, I said, well, you must be pretty old. It was over 40 years ago that I did that. But anyway, here's the thing. The question I have is, if the laws are still in effect, so if you get a call that somebody is alleging neglect or abuse, you've got to go. I mean, right? You can't plug in a model and say, maybe we'll go, maybe we'll not. I mean, you have to
No, it
follow up
depends
on
on it depends on the call, Mr. Heckman. If it's a CPS call, those are physical or sexual abuse. Those we absolutely have to go.
Okay.
If it is.
You mean through the abuse hotline?
Sure. Well, and all of these calls could come through
All right,
Childline.
okay. So you're going to be basing, somebody calls in and says, this child's in trouble. So if they say sexual, or they indicate a sexual to you on the phone, or they indicate a physical to you on the phone, you got to go out.
Correct.
Okay.
Correct.
And
But
where
all
would
the-
you make judgment calls?
So so those are CPS, Child Protective Services.
Right.
But and I'm right so far, Robin? Okay. The GPS are the General Protective Services. So those are the neglect, parent-child conflict, truancy, custody issues that come our way. So those are some of those are also, oh, absolutely, we're going.
Well, I was
Some
going to
of those
say,
are-
because neglect has always been one of those that could fall into, somebody calls you and says, this kid's running around, he without shoes on, and his mother, he's claiming that he can't go in the house because the mother locks the door when the men come. I mean, no, I'm using old examples.
I know.
So the thing is, you'd almost have to go out on that. There's no physical abuse,
And
and
that's
there's no
why.
sexual abuse,
And
but
that's why it's meant, you're correct. It's not meant to be you only look at this number. But
Okay.
if you get those cases that either you're on the fence or are just not crystal clear, that's where the model comes into play.
So
But-
somebody calls in and they just say, I don't know, got problems, this and that, and you're gonna do a staffing on it or something, you would probably wanna run it, if you put this model into place, you're gonna assign ratings, I would guess. Ultimately, at the end of the day, you're gonna say, wow, this meets all those markers.
Yes,
And
so
we should,
it will be an additional tool in the tool belt, but it is not intended to replace the other screenings we already do, or the caseworker, supervisor, human,
and-
clinical experience
you know,
decision-making.
is this like Iris would really be, or is this gonna actually be used in this children and youth?
We have 2 call screeners that work for children and youth. They happen to be physically located in Iris, so it can be confusing. When you all agreed to allow us to add the second call screener, one of the benefits of that was sometimes when we get calls that are, to your point, Mr. Heckman, like, I really have to go, but maybe it turns out to be nothing.
Yeah.
One of those call screeners can go out and do a quick initial visit before we even decide to screen that in for investigation. It's just a quick initial sort of touch point visit. And so, yes.
Okay. When were you hoping, if everything went right for you, when were you hoping to implement this?
Well, if all the stars keep aligning, you know, we would love to have a contract executed July, or, well, I'd love to say July, but certainly August. Rima and her team are ready to go now. The contract, we've gone back and forth on the contract. It's in their hands. They're ready to sign it, and I am waiting to get it back and then flag it for the boss, so we have the right conversations here and.
Do you have input, you said a 3-year, and you asked about, well, and I don't want to get into the money now because it's still vague. If you say, hey, this is great, we want to keep it, is there like a licensure fee you think
Nope.
you're going to have to pay
It's
out the
our,
end?
it is ours.
It belongs to you after the contract.
Yep.
What if you're using it and it's just not worth what you were told?
That would be very upsetting.
But, I mean, do you have any outs in the contract?
I actually have not laid eyes on it yet,
All
Mr.
right, all right.
Heckman.
I
So-
know, well, when you said July, because I know this takes time and you've been working on it.
Sure.
I didn't know what your time frame was.
Sure.
But it sounds like you may be coming with a budget or amendment or a contract, but you don't need to. You already have it in your budget. Is that what
Right,
you're telling us?
we have the fund, yes, the funding,
So you
I
don't
don't,
need to come to us then for extra money.
We wouldn't, no, but we wouldn't implement this without.
Oh, all right, but-
Without council weighing in on it.
Well-
This is too important.
Yeah.
A public policy change, not to have council let us know what its sense is.
I mean, I'm not against it. I just saw it now. I
Yeah,
mean,
no, it's a lot to digest.
People have been coming up and trying to use tools for decades, to help predict and,
And the contract may exceed a level that council needs to approve anyway.
yeah.
It will be in front of council
All
in
right.
one form or another.
I mean, yeah, you answered, I mean, for now,
sure.
I was just trying to figure out at what point in the process and with who this might influence, but I think I got a better picture of it now. Thank you.
Look, I've been trying to absorb this for 2 years, so, you guys are quick studies.
Okay, thank you. Mr. Giovanni, do you have any questions? Mr. Cusick, you still with us? Yeah. Oh, he's just in the zone over there. So you said
There's other counties still counting votes right now, that's,
oh, so you're. It's like what's left of baseball, right? So I think I've heard all the answers to my questions in terms of you have the money squirreled away, the
We
costs
do.
are already there. The sum you quoted
Yes.
includes training costs? Because my question is,
Training of staff?
yes.
Yes. Yep.
I think I have questions, but not for today, on
Sure.
how that would be handled. That's down the road. I'm curious to see how you're going to do that.
Absolutely.
And then I guess the only other thing, and again, it's not necessarily a conversation for today, but in the future, would be, so how are we going to attack the other end? Because the predictive and who we're sending is one thing, but that still doesn't mitigate the cost on the other end of how all these kids are in placement, how long, and who those vendors are.
Yes,
So what are we
absolutely.
doing at the other end to look at that? So if you want to talk to us,
Well, we can.
or if we want Julie to come in and talk about that down the
Well,
road.
maybe Julie, maybe when we do COF, and Robin can probably speak, I know Robin can speak to some of it, because the one thing I can tell you today is, when I first started here, you said, when you come with drug and alcohol, bring the outcomes. And I call drug and alcohol, I say, what outcomes do you track? And that became a very interesting conversation across our divisions. And so in this year's contracts, for the first time, they've always had certain requirements and reports that they get and outcomes, but we improved, increased, modified the outcomes that we're requiring. So instead of the nice fluffy report about all the great things our agencies did at the end of the year, we're getting the information we want to have. And one of the things we want to look at with foster care agencies in particular is how many times have the kids moved? How long did it take before they either were reunified or adopted? And that's look, the biological family and court, there's a whole lot of factors, but we know that the agencies have an impact on that as well. That's a longer term process, but we've got some ideas on assessing our vendors.
Okay. And then another question, which would segue into the other area, which is the state of Human Services is, so where does civil service status? Because again,
Yes.
the biggest problem we have with children and youth is filling those positions and civil
Quickly
service.
enough, yes.
And I'm seeing that there's ongoing meetings, so where are we with our process?
We heard from them probably about 6 weeks ago, I think, and they asked for copies of our job specs, which we did not send them the first time because we were told we could use civil services job specs, which we did. And so we didn't resend them their own forms, but we actually had to take the word civil service out. So Georgine did that for us, and they went through Liz, and we resent those about 2 weeks ago, I think. So I am just trying to be optimistic that that is the only thing that we were missing. And they said that they would get to it reviewing our application as quickly as possible. So I figured I'd give them a month, and then I'll sick Georgine on them again with some, how's it going? What do you need from us? So I was optimistic in that they acknowledged receiving our application. They actually looked through it because they told us what they still wanted from us, and so that's where we're at.
Okay.
It'd be a great Christmas gift, or, fall, Halloween, 4th of July, anything.
I just know, I keep getting updates that there are civil service meetings in place, and they're always like right when I have clients, so I
You're
can't
not-
jump on.
It's, the ones that I know about are definitely, we participate in, but they would not, for you, it's not, you're not missing any information. It's more
Okay,
of a,
thank you.
you're
Thank you
welcome.
for that permission to excuse myself.
I don't
from
mean they're
that.
not useful, because they
No.
are, but it wouldn't be useful for your purposes, I
Thank
don't think.
Okay, so then transitioning. You
Sure.
want to take a stretch or yoga stretch, whatever?
I'm good.
And I just want to say, she's standing there a long time.
That's okay, I'm good.
And I don't know, Aileen checked on the recording? We're going to have a conversation about that on another day in another committee. How's that?
That sounds great.
State of the state.
Okay.
You answered my civil service question. And I guess while you're getting ready, I should announce that Jen Stewart King was supposed to be here, but she's had surgery and is having complications from that surgery.
She had
So-
the Cadillac version, she calls it, of LASIK, and she said she should have stuck with the Subaru version, and she said we could tell you. She is finally starting to make some progress, but she can't last more than about a half a day without just migraines, and so, but she's much better than she was a week ago. So she apologized she couldn't be here.
I just want to say, she's not being avoidant, she's
No.
proactively healthy, so good
Yes.
for her.
So, okay, you ready for the rest?
Sure.
Okay, I'll go finish going through human services, and then I do have some Graysdale information, and if you guys have Graysdale questions, Lamont and I can, I think, answer most of them. We've talked about call volume, so kind of during COVID. Gary Rushman pulled the data for me, and in April, the calls were significantly down across the board, except for aging, where they were down, but not as substantially as other areas. So the way they track, we have early intervention, developmental programs, mental health, children and youth, aging, and then involuntary mental health commitments. And in May, all of those categories, except for aging, were still down. And let me just give you so for aging, for example, In May of 2019, so a year ago, we had 102 reports of need for our older folks, and this May, we had 117. None, thankfully, on the severe end of abuse or neglect. A lot of the home alone, isolated, worried about, they need food, that kind of a thing. But children and youth calls, May last year, 833 calls, May of this year, 452.
Say that again, I'm sorry.
That's okay. May of 2019 was 833. This May, it was 452. Now, it's interesting because folks outside the CYF world say, oh, that's great. And I say, well, in the short term, for a manpower issue in COVID, we're not having to go into people's homes, but really, no, it's not good news because families are more stressed than ever, and children don't just stop being abused because there's a pandemic. So I don't know at what point that will start to pick up. It's picked up a little bit, but not substantially. So I just wanted to, I know folks have asked how the call volume has been, so that's where we're at. It appears, I have guidelines from aging from the state and from early intervention and children and youth, and it appears that because they changed, of course, the way we do home visits, like we're not doing many home visits unless there's severe abuse and neglect, high risk in children and youth. I mean, there's certain categories we have to still do, but all the other ones, and it appears they are not going to, the state is not going to change the guidelines to restart home visits until we are in green. And I don't know if it's on day 1 of green or day 14 of green, so that remains to be seen. So our folks are just spending a lot of time on the phone, trying to touch base with folks much more frequently than they would have if they were even going in person, but it's tedious.
Can I ask a question related to that?
I'd like to get through. Can you hold it? Can you hold on to it? No, go ahead. I want her to roll. Go ahead.
I'm trying
And
to
then we
really
can,
say it, but let me just make a note.
No, take,
Notes are good. We, as you know, the building, Human Services building is also reopening to the public on Monday. And you all had seen the extensive document we put together for the safety of our employees, so I thought I would just give you a heads up about the things we've done for the public coming. Anybody over 2 has to wear the mask and get the temp screen. We're gonna try to do everything, not everything, as much as possible by appointment so that we are limiting the number of people just walking in, because we have rearranged our lobby to allow for social distancing, but at max, it will fit 8 unrelated people, or more than that if they're families and they can sit together and they don't have to distance. So we're purchasing some benches for outside under that big covered roof, because we anticipate that the first couple weeks when, like, the revenue office is open, people paying their taxes, dog licenses, fishing licenses, that it'll be busier. And those revenue folks don't call for appointments, they just walk in. So we've done the
Excuse me, Madam Chair, the meeting is on YouTube.
oh, okay, thank you.
You're welcome. I wanted to check that for
I
you.
appreciate that,
You're
thank you.
So the lobby's rearranged. The sheriffs, we have an extra sheriff now in the morning so that as employees and members of the public are coming in, we can still use 2 entrances and stop the overflow. We are going to, unless it's an emergency issue or something that can't be avoided, say with children and youth, limit the hours of 9 to 10 for folks over 60. Clean the lobby throughout the day. We've got the hand sanitizer at the front desk. We have masks at the front desk for anybody who comes in without them. Children and youth, we're trying to schedule as many visits as possible once they get restarted. They will, we think, slowly be restarting at providers' offices where they have less foot traffic. We're asking parents to bring their own toys, and we will make sure that we clean the visit rooms and toys and lobby area either after each use or throughout the day. And the state has provided us in different forms guidelines for doing home visits, and they match up with all of the stuff, Mr. Myers, you had asked about, like the PPE and what we're doing, and so we're in good shape. And we are regularly replenishing our stock and operating under the assumption that at some point we will have a second wave. If we all keep wearing our masks and doing our thing, we can hope we don't, but we'll be prepared either way. And other than Graysdale, the last human service thing is World Elder Abuse Awareness Day is Monday, June 15th. So I think Becky Bartlett is working on a press release for us, but our aging folks, we're working on getting small purple ribbons to tie in our trees around the Human Services building. So I thought that was a nice idea and just wanted to let everybody know.
World Elder Abuse Day.
World Elder Abuse Awareness Day.
Don't beat your old people.
So I have some Graysdale
What does it
info, but if you wanted to take Human Services, like DHS stuff
Well,
first.
Mr. Heckman had a
Well,
question.
no, I just wanted to ask, you said the caseworkers are not going out, they're using the phone? They're using the phone? Is that because of the COVID? I mean, the state's
yes.
okay with that? Because,
Yeah.
I mean, in certain cases, you have to go out. but-
Yes, we still have to go out, and I'm not gonna capture them all, but we still absolutely have to go out for every new allegation of abuse, that anything that has to be investigated, we still have to go out and physically go to the home or wherever the child or family is. Our high-risk cases in children and youth have to be seen in the home weekly. We're still doing those home visits. It's the low-risk families
You can do that on phone.
and aging that are done on the phone. But if we have a concern that we are concerned enough about, Mr. Heckman, we'll be going out and doing a home visit regardless
I
of
was just
the
curious
state.
if that was in
We would
line.
never make that, no, it's based on, they have our license, and we would never do that without their permission.
And I have one question
Yep.
about commitments, because I've heard conflicting information that people that did need mental health commitments were sometimes being turned away. It came up at the mental health meeting the other day.
They were sometimes what?
Turned away and were not admitted, and that
By the
hospitals
ER.
were not admitting
Oh.
commitment versus I heard some that were. So I just wondered if we had any data or numbers on that. And if not, you could get,
I definitely don't have hospital data, but I can tell you that in last May, we had 60 mental health and voluntary commitments, and this May, we had 42. And they were also down in April. But I got the sense from Gary Rushman that at least in April, that was because we had less folks who needed commitments that we were not getting calls about. He said starting in May, that started to pick up sort of that like isolation, anxiety, depression, being confined and quarantining was starting they were starting to see an increase in calls, but they're still down compared to last year.
okay, that leaves Graysdale.
Okay. So, in no particular order, I have a few different topics. I have call-offs numbers because we've talked about that every meeting here for a while. These are just the nursing call-offs, so like dietary, housekeeping are not included in these numbers. I'll give you March, April, and May. In March, we had 830 call-offs in nursing. In April, it was 966. And in May, it was 760.
What was March again? I'm sorry.
March was 830.
Thank you.
And nursing includes RN, LPN, and CNA, or just?
Yes.
Okay.
Yep.
Thank you.
Yeah, we would never get to 200 even without the CNAs in there. So we definitely, the good news is we've seen a reduction by 206 from April to May. However, our FMLA calls went up from 150 to 204. So we really have only about 150 fewer call-outs. That said, the mandates, not that said, that because of that, the mandates are down. In April, we had a mandate 38 folks, which considering there were 966 call-offs, it's not horrendous. The mandates were down to 25 in May with those call-outs. So staff at Graysdale are across the board, all divisions have been asked to pick up one extra shift. It's either a pay period or a month. I don't know if we went back to it being a month or if it was a pay period because of trying to find a way to deal with all of the call-outs. And the other goal was to try to reduce mandation. And so clearly we've reduced, so May was the first month that for the full month, everybody had to pick up the extra shift. And clearly the mandations were down. But, we need more folks to continue to come back to work. And take the weight off these folks who have been coming this entire time. So I guess I can be cautiously optimistic maybe there. In terms of COVID numbers, this is from yesterday. We have, in terms of residents who have tested positive, 218. 73 of those are currently in Graysdale. 4 are in the hospital. 78 have resolved. So they're better, feeling better. And unfortunately, 63 have passed away. That number is at least a few higher. We were cross-referencing our data with the coroner's data. It's a little bit convoluted at this point. The state is requiring that when someone dies from COVID, if they're in the hospital or if they're in Graysdale, the death is to be attributed to the person's residence. So if someone lived at Graysdale, ends up in the hospital because of COVID or their other health conditions and passes away in the hospital, that should be attributed to Graysdale. Some of them are getting attributed to the hospitals, and so it's, yeah, I am told that the coroner data throughout the whole state of Pennsylvania does not match the state data reporting system. So, but the good news is, you know, obviously, Mr. McClure said you figure it out, and so Zach Lysick and Brian Dunlap figured it out. I just didn't bring that particular printout with me, so I think it's closer to 67 or 68. And 23 residents are pending results. Again, this was as of yesterday. In terms of employees, we have had 48 test positive and 3 employees still pending results. That number has stayed really flat, the employee number, for quite a while. We peaked, it was on a huge uptick until around 40, and it's really been, well, I guess sort of going down, but so that's some good news. Questions about that?
I have a question.
Go ahead.
Just two
Sure.
questions. One, COVID death, does that include when they do that? Like, we know you have very ill people.
Yes.
If it's like a heart condition, a diabetes, and then they end up with COVID, are they counting that as it COVID or is it COVID related? And I don't want to get into the weeds, I'm just curious.
There are no weeds. The Department of Health mandated at the beginning of the pandemic that anyone who dies with a positive COVID test or tests positive upon autopsy, their cause of death must be listed as
counted.
COVID, irrespective of the other comorbidities they have.
I thought that was it, but it's been quite a while now, and I didn't know if you were still, so that's the case.
That is the case. So
Okay.
those 67 folks, and we're still rationalizing that, the numbers, I mean.
No, I understand.
And it's heartbreaking work for us, but we're doing it. And the fact of the matter is, if you're positive for COVID and you pass away, it's on your death certificate as a cause of your death.
Okay, good. And I know there's nothing you can do about that. Well, I had 2. Remember I said I had 2 questions?
Oh, I'm
But now, in
You're cutting me off all the time.
I don't want to be misleading. In fairness to them, acute respiratory distress syndrome is also, I'm told, on most of those death certificates as causes of death.
Yeah.
So that's something that's being seen in the hospital. So
I was just curious where they were still at, but you answered the
I don't
question.
want to.
No, you answered it.
I don't want to lead the perception out there that I don't think these are actually COVID.
No,
They are.
I was just wondering, like, if, I didn't know how they were still parsing that out, if they are at all. The other question was, what's the census as of today?
I don't have that number today. As of yesterday, it was somewhere around 540.
Okay,
We have so Tower 10 was the isolation unit, so those are 50 beds. And that was largely full, I believe we were talking about with Jen yesterday. So we've moved people from their floor to Tower 10. So we can't take new people in Tower 10, and we can't take new people where those beds are because we have to save them. So that, we're talking 90-ish in terms of just sort of, holding that. Obviously, the Graysdale folks can give you more detailed information, but admissions are still coming in. And a lot of places still aren't taking new admissions. So the good news is we're still getting folks, but certainly at a slower pace, and folks have said, Graysdale's in the news. I'm just gonna wait a little, I'm gonna keep mom or dad home a little bit longer, so that's where we're at.
That was it for me, thank you. That was it for me.
Thank you. John, are you did,
No, she can go.
okay.
I just wanted to follow up on, the woman that was here last week.
Mhm.
Her mother was moved from
Right.
10-3.
Yep.
You said that you were gonna follow up with her.
There was two women,
Yeah, your friend.
I gave the one you're referring to, I gave her my card. I did not hear from her, and I actually don't have her contact information. I think she had spoken to Lamont. The woman who came and was talking about her husband, I spoke to her for about 45 minutes, and I think we had a productive conversation. So I did speak to them, yes. Did you have a question besides that?
I just wanted to know if it was resolved, if their concerns were resolved, if you were able to resolve their concerns. I mean, sometimes you talk to people and you can't, there's nothing
Correct.
you can do for them.
Sure.
but What was the outcome of that? Was it positive? Did they leave feeling better? Or
I
did you
think-
were you actually able to do something?
I think neutral to better, but I can't get into some of the specifics because then it would just be, you know that, but some of the angst and concern is entirely understandable and entirely unavoidable. And so I listened, I tried to alleviate concerns and stuff, and I think the woman that I spoke with, I think she and I had a very productive conversation. When I last left off with her, she was making arrangements to have Cheesecake Factory pre-sliced cheesecake brought in to Graysdale for her husband's birthday. So I think she was happy about that. But they miss seeing their family members. I don't blame them. It's a terrible situation, but one that I don't have control over. So
You haven't heard from the other one, or did she talk to Lamont, the Kroll woman?
Yes, I spoke with her.
Okay. And
Well, so that issue is, it's multi-layered, and there were many pieces of it, and we talked about all of them. But I think ultimately, the problem was people being moved from Tower 3. And the only reason that Ms. Stewart King made that decision was because there wasn't enough staff in April to safely care for everybody who was living there. So she just had to make that decision to empty out that tower. They may have done it expeditiously. They may have not been, they may have not been as sensitive to the needs of the folks who are living there and the needs of the folks who love them. We acknowledge that. We're sorry for that. But the fact of the matter is there weren't enough staff coming to work to care for everybody with that tower being, having folks living there.
And her response to that? None, haven't?
Well, at that point, I think her primary concern, which I understand, and I do feel her pain, was that she felt as if not enough attention was paid to her mother's feelings about being moved. And I don't know the answer to that. And if she wasn't treated in that way, I apologize to the family.
There was one of the workers who answered the phone in a manner that wasn't necessarily professional. Was that person reprimanded or?
I have a description of that person. Interestingly, I have received more than one complaint like that about multiple people who were answering the phone during this time. And while there's really never any excuse to not treat a loved one of someone who can't be seen by their loved ones with anything other than the utmost respect, I mean, let's also be empathetic for the people who were walking into Graysdale terrified of contracting and becoming sick from COVID-19. So a lot of stress involved in these processes, and I really have a hard time being overly critical of folks who are showing up shift after shift after shift and being mandated, and we will deal with that issue going forward.
Sure, and the reprimand could just be further instruction on how maybe to handle someone falling in.
So it's a personnel issue, but I can tell you, Councilwoman, the information I received about the rude treatment from multiple families about people taking their phone calls has been passed on to administration for further investigation.
Right, yeah, well, we don't want any other things to go, that's a small thing.
Yeah, I agree. You're not wrong. I mean, everybody is so, this is such a difficult process for everybody.
Yeah, no doubt, no doubt.
Okay, John?
Yeah, thank you. Yeah, this situation is very difficult.
Sure.
I think compassion is what was lacking there. How many bed licenses do we have for Graysdale right now? 660, 650?
680. I think it's 688.
688.
So we have 140 unused beds at this time.
Technically, on paper, yes. Not all of those could be filled because of people being up on Tower 10, but yes, technically on paper, you're correct.
I understand that, but, we did have a
Yeah.
census problem even before this, so, I mean, I've called for this for years, maybe it's time to start looking at, 4 people to a room and whether or not that's the best practice moving forward. Going back to the call-outs, do you have reasons for them? Was it illness, fear, childcare? I mean, that must have been an issue for some of the
Childcare is an issue for
employees.
some. I think Jen or Dawn answered this a while ago, and I think the answer is the same. It's some of everything, but mostly folks, I don't know that a lot of folks give a reason. If they just call out and they're sick, they say they're sick or whatever they're saying. I know Dawn had instructed her folks early on to ask, is this a childcare issue? Because we might be able to help. But I can ask Dawn and find out if she has a breakdown more specifically and get back to you about that.
Yeah, and I guess, since we do have fewer patients, do we currently have fewer employees, and are there vacancies? And if there are vacancies, what's the plan moving forward to fill them?
Well, there are fewer staff coming to work, but I can tell you what we've hired in April and May. In April, well, actually, let me just do this. Let me give you what we've hired in 2020 instead of writing down all these different months. In 2020 so far, we've hired 6 RNs, 2 of them which are full-time Graysdale employees. The rest are per diems. In 2020, we have hired 14 LPNs, 7 of whom are full-time Graysdale, 3 are part-time Graysdale. I'm sorry, 4 are part-time Graysdale and 3 are per diem. CNA, there's 2 categories. We have the temporary CNAs, which I'll tell you, actually I don't know that I have that number, but we have hired a total of 35 CNAs, 30 full-time, 5 part-time, no per diems. So those are the number of new hires. I don't have the numbers, we can get these from Jen for next time, the number of resignations, terminations. I know HR in Graysdale told me that there was an awful lot of phone calls of folks who were either afraid to come to work, didn't have childcare, didn't have this, didn't have that. Some folks asked us to hold their position until there was no COVID. I mean, all sorts of requests we got, but ultimately, there's a lot of people who end up resigning. I shouldn't even say a lot. I don't know what the number is, but I know there was a fair amount. One of the things they were told is, listen, it's okay to resign. It's understandable. As long as you leave in good standing, you can come back. And so we tried to leave that door open for everybody, every good employee who leaves. And we also hired, not on this list, we hired, I think at least 3, but I don't want to overstate it if it was 4, 3 or 4 nursing supervisors in May. So that was great news, because those, I mean, everybody's overtaxed at Graysdale, but those folks have been struggling as well to keep up.
Now, my last question, there's been talk about whether or not nursing homes were forced to accept people that
Tested
you
positive.
knew were positive
Yep.
tests. Was Graysdale ever forced to or knowingly had to admit patients who tested positive?
No, and we had discussions about how to handle that if it happened, and we would have had more conversations, but to my knowledge, we did not accept anybody who tested positive for COVID unless it was our resident who was sent to the hospital and returned. So,
May I, you getting it up, may I follow up on that, though? If someone applied with COVID to come to Graysdale, and let's say they couldn't get in other places, if you could incorporate this in, would our reaction be, we won't take you because you have COVID?
They had to have 2 negative COVID-19 tests to be admitted to Graysdale.
Okay.
To Mr. Cusick's larger point, as long as I am county executive, Graysdale will be publicly owned, but I won't be county executive for years. But it may be time, council, for us to talk about no longer being the largest nursing home under one roof in the Commonwealth of Pennsylvania. It may be time to talk with AFSCME about that. It may be time for us to talk about that. I was talking more than a year ago about the potential abuse of FMLA at Graysdale, and the 1/3 of our workforce there who routinely calls off, citing FMLA. I don't know of any other institution that could function with 1/3 of its staff routinely calling off. Now, for many, many years, many, many positions went unfilled at Graysdale, and you can see, you know, you've looked at them all, have gone unfilled, and that was to make the bottom line look good. But there's a stasis, a homeostasis that needs to be achieved, and that is not 900 full-time employees at Graysdale. It's not. It's 700 full and part-time employees at Graysdale regularly coming to work if we want to maintain the largest nursing home under one roof in the Commonwealth of Pennsylvania. And we really do want to maintain that, because you're right, we have 688 beds. There's going to be more need. There are a lot of folks out there who are poor. There are a lot of folks out there with dementia, a lot of folks out there that are sick, that are gonna have nowhere to go. So I think the long-term prospects for Graysdale's beds being full are good. I do, even in this darkest time period. I do. And I also think because of economic conditions, we weren't able to hire because the economy was good, right? People would rather go work in the Amazon warehouses, for example, than come to work with us as a CNA. But I think as the economy struggles because of the economic disaster that the global pandemic caused, let's face it, the coronavirus caused it, right? I think the long-term prospects for employees at Graysdale is also good for hiring new folks, but these are long-term prospects, and I think in a parallel way, we've got to talk about maybe not being as big as we are anymore. I don't know what else to say.
Madam Chairman? I kind of understand where Mr. Cusack's coming from, but as a person in this new age group that is retiring, and there's a large number of those folks, there are quite a few who aren't going to be financially capable of handling this. I'm leaning that we're probably going to get more bodies within the next couple of years than we probably can't count on, because with people being laid off and jobs eliminated because of what's going on with coronavirus, as I can speak to that on personally from my end of things and people that I know. Maybe we may be putting the cart before the horse. Let's see what's going to happen in the next 6 months and see what's going to happen. Because I got a funny feeling, you're right, people aren't going to be able to get the jobs at Amazon and FedEx and everything else. They're going to be looking for some way to feed their family. But they're going to be people who are destitute. They're, going to lose their homes and everything else because of everything that's going on here. And I think more than anything else, several years ago, overwhelmingly, the citizens of this county decided they want the Graysdale to stay in the hands of what it is. And as long as I'm sitting there, I plan on giving them what they want.
Yep, me too, but
Maybe we can share a room.
I think I'd like to just
that's good, because I can
terminate
knock
the
off
meeting
my
on that
visits with
note.
one trip.
That's just like, stop.
And then you could share the cookies or whatever.
Oh, my God.
Free cheesecake.
Pre-sliced cheesecake for the boys.
He has a healthy appetite, though. I don't know if I'll get any cheesecake.
I want cookies.
Oh, my God.
Are we done?
I'm sorry, Mr. McKee, go ahead.
I just had to follow up on that, and it's good points, and I just Googled the baby boomers, right?
Thank you.
So the oldest baby boomer is 74 years old, I think,
Right.
according to my math.
I'm not the
youngest
oldest.
is 50 Youngest is 55, right? So I'm at the other end of the spectrum. So again, that's a big group.
Yep.
That's just starting to hit their 75.
Yes.
You're below that number, right?
I'm below it.
So he's a Gen Xer just trying to forget all of us.
But, I understand his point.
By a month,
and
right?
I understand your point with people not showing up to work. Regardless, I know there's laws in place and regulations, and we have to follow all those, but, the bottom line is you gotta care for these people. I mean, we put ourselves out there to have this ability and this, they really gotta come to work. That's a big problem. That's a big problem.
And we should note, sorry, Sue.
That's okay.
And we should note that even during April, with 1,200 and whatever callouts, we did never drop below the PPD, right? Yeah, not PPE. We did not drop below the PPD of 2.7. I don't even think we got close. We may have on some shifts,
Right.
but for the overall day, we never dropped under it. So, we're still doing the job, but we're not doing it as well as we could.
Madam Chair, we got to adjourn.
I know, the chair of the next committee is having agita, so I need to terminate this meeting with like a second to spare, but thank you for all your updates.
Thank you.
Welcome.
And if Mr. Dunlap could come next time, maybe with some, again, I know we're under the new billing system, he could continue to talk about that.
Sure.
Maybe there's less to be concerned at than it originally appears. But thank you.
Yeah,
Thank
appreciate
you.
all your efforts and the staff's efforts.
Yeah, and
Thank you.
And especially for those who came to work and didn't call off and didn't take FMLA and whether they were edgy or not, but for their faith.
Absolutely.
Determination. Because I even got that in the mental health meeting the other day, that everybody was just really trying to do their best and adjust to every time somebody said jump. So
That
thank
is
you for
correct.
all of that.
Thank
All right,
you.
adjourned.
We're gonna take 5?
Take 5.
Are you okay? Yeah, I mean, even if you roll it back, he's not going to care.
Oh, absolutely.
John, you don't care. He's like that.
What do you want?
No, I don't want him close to you. I just